Hello, everyone. Welcome. Thank you for being here for our event, our second event, actually, in our Women Neurosurgery lecture series. Today, we have four stellar panelists who have joined us. I really thank them for their time, for coming in and chatting with us and sharing their experiences of some of the things that they have achieved and what their plans are and for the future in neurosurgery as leaders in the field. And again, once again, we're really thankful for their time. So without further ado, let's begin. So we're just gonna talk just a couple of minutes about essentially what CaMSign is all about. As some of you are aware, so just to introduce myself, so my name is Kadram, and along with my colleagues, Mohammed and Salman, we essentially co-founded this group about 6 months ago. And in that period of time, we've actually had a few events to essentially bring in experts in the field and residents, as well as other members associated with the field of neurosurgery to talk about their experiences, their research, and sharing kind of a little bit of their typical day of what neurosurgery is all about. So with that in mind, our CaMSign group essentially has many goals, but some of them are mentioned here. It's basically the vision that Mohammed, Sawan, and I had was to essentially start a platform where we can educate, or where we can promote education for neurosurgery research, as well as to advocate for different aspects, such as the Women in Neurosurgery series that I'm going to talk about a little bit, as well as equity and diversity. And so, like I mentioned, we've had a few events where we've welcomed residents, neurosurgical residents, and faculties and other experts to share a little bit about their life, a little bit about their professional careers, as well as any research that they have done. And also to, as our future plans, we have coming up is to essentially also hold events where we talk about other fields that are also related to the field of neurosurgery, for example, neurology, neuroradiology, neuropathology, neuroscience, and have some experts come talk about those areas as well. So with our Women in Neurosurgery series, it's like I mentioned, this is our second event, so it's a very new series, and we are very, very excited about it. And the whole reason why we started this was essentially to advocate and encourage more women medical students to pursue surgical fields, as we know that the ratio typically tends to be more male dominant. And so we want to, bring in some experiences from female surgeons, neurosurgeons, to talk about, some of their challenges prior to, during, and after their neurosurgical residency, and as well as to learn more from them, as they are all the role models in the field, to talk about how they balance, their personal life and their professional careers, and essentially much, much more. So for our previous event, as some of you were there, we had we welcomed Professor Mojigan Hodai to come and speak to us for last month in March. And that was a terrific event. It was a great Kickstarter. And so we were really excited about it. And what we have actually coming up is another panel discussion specifically on maternity and motherhood in the series. And more details will definitely be announced soon. So feel free to check our website. We actually have confirmation from one of the neurosurgeons at Dalhousie, Dr. Jenna Smith-Forrester, who's coming to speak for us, and we're planning on having another speaker on board as well. So just keep an eye out on those details as they will be shared soon. As for our other events, other future events, we have two coming up, one next month and one in June. The first is Dr. Eagles talking about vascular neurosurgery, and Dr. Das, Professor Das from UofT, coming to talk about his life as a neurosurgeon and his wonderful experiences that I'm sure will impress many of our audience. So we're very excited for those as well. And lastly, just a quick reminder, so we're very active on social media, particularly on Twitter. So if you haven't followed us, make sure to do so you don't miss out on notifications, and we'll be happy to connect with you there as well. Okay, so with that said, I'm going to stop sharing, and I'm going to pass it on to Mohammed to introduce our panelists.
Yeah, hello everyone. Welcome to our panel session today. My name is Mohammed. I'm also one of the co-founders of CaMSide. So we are delighted to have all you all in this session, and I'm really thrilled that we have like three of the panelists present today in our panel session. We have Dr. Mansur, Dr. Hanyan, and also Dr. Saira Alli. So I'm going to read a brief introduction of each of the panelists we have, and then ask them to also give a quick introduction of their own background and their trajectory to get to the residency program. So I'm going to start with Dr. Saira Alli. She completed her MBBS degree at Imperial College School of Medicine in London in 2009. And following PhD work at the Hospital for Sick Children, she joined the Toronto Neurosurgery Residency Program in 2018. She's PGY5 now. And so Dr. Alli, could you please briefly discuss your background before choosing neurosurgery and your trajectory until receiving your offer, please?
Yeah, sure. So hi, I'm Saira. I started out from England, obviously, as you heard. I did my medical degree at Imperial. I actually was an intern in Cambridge, and then I did some training in Leeds before I came to Toronto to do my PhD, which I did with Dr. Rucker. And then after that, I transitioned to the Toronto program. And as you can tell, seeing as I joined in 2018, I had some of my prior training accredited, and I'm now in the PGY5 year. So that's pretty much, mine's probably a bit more of an unconventional background, and I classify as an international medical graduate because of that. And so I'm happy to answer any questions about that anyone has.
Thank you so much, Dr. Alli. Next, I'm going to read a brief introduction of Dr. Hanyan. Dr. Hanyan earned her MD program at Western University, London, Ontario in 2017, following undergraduate studies at Harvard. She joined the Toronto Neurosurgery Residency Program in 2017, and she will pursue her PhD degree with Dr. George Ibrahim in the Hospital for Sick Children within the University of Toronto Surgeon Scientist Training Program. So Dr. Han, could you please also answer the same question? Could you please discuss your background before choosing neurosurgery and your trajectory until receiving your offer, please?
Well, I think that introduction had said most of the critical points, but I think, when I was even choosing medicine, I was thinking very much about education versus medicine. And I think I lean towards medicine because it is an ongoing learning process where you're ongoingly teaching people. And I think with surgeries, especially, it's very many parts of it are like an apprenticeship where you're either learning and teaching at the same time. And so that's something that I think really drew me towards something more practical and hands-on like surgery. And also the interest in the brain, which I think is fascinating, really led me towards neurosurgery. But yes, right now I'm in my first year of my PhD in clinical epidemiology with Dr. George Ibrahim at Sick Kids.
Thank you so much, Dr. Yan. Next panelist we have would be Dr. Anne Mansour. She completed her undergraduate and MD degrees at the University of Toronto. She joined the Toronto Neurosurgery Residency Program in 2018, and she's currently PGY3 resident at the University of Toronto. So Dr. Mansour, welcome to our panel. Could you please also answer the same question? What's your background before choosing neurosurgery and your trajectory until receiving your offer?
Perfect. Hi, everyone. Thanks so much for having me. And sorry I'm late, as you can tell, I'm on call, so hence the blue scrub. So I guess the introduction sort of alluded to the fact that I'm a bit of a UofT lifer, so I did everything here, but I was always interested in the brain from day one. I do have a personal connection with neurosurgery with a close family member of mine, and so that did spark my interest in the brain and the plasticity around the brain and kind of critical conditions that we could help. So I did a lot of research and into cognition and both neurovascular events and brain tumors as an undergrad. That kind of sparked my interest in medical school. And then I just love working with my hands. So I think that kind of narrowed things down pretty well for me. So as you know, I'm a third year resident. So I'm at the kind of end of the junior life, the lights at the end of the tunnel, I guess. And I'll be starting my PhD in July with Dr. Yvonne Radovanovich in neurovascular conditions.
Perfect. Thank you so much. So unfortunately, we don't have Dr. Dandrand here yet. We're expecting her as well. Maybe she's also on call. Hopefully, she can join us for the rest of the session. But now I'm going to pass the stage to my friend Saman. So Saman, could you please explain the structure of today's session?
Yeah, absolutely. First of all, thank you to everyone who joined us today. We have a lot of great questions set up in the first hour. This is a semi-structured interview, so we're hoping that the residents can sort of gauge it and then sort of take it there. And then we'll have 30 minutes remaining for anyone in the members who would like to ask questions. If you'd like to do it via microphone or send in the chat or in Slido. So just to give a brief synopsis of the themes. So the first theme, we're going to do background questions, and we're going to follow up with tips and advice. We have a lot of medical students here that would be interested. Questions pertaining to mentorship, life as a neurosurgeon in training, and some miscellaneous questions as well. But before we sort of do that, I just want to make sure that everyone has access to the Google Doc so they can register for our future events. And with that, let's go to the next question. One of the questions, this is of course for all the panelists, is that the perception that people have of neurosurgery before going into residency sometimes changes or alters during residency. We want to know how it was like for you when you thought about neurosurgery and whether that conception or idea has changed at all.
I can start with that one. I think the best thing that you can really do, which is what I did, is to, you have an idea about something, but I actually did neurosurgery as an elective abroad. So I was in Cape Town, South Africa, and I had seen it in London, England, where I was at the time. And I think, it is different. I think a lot of people have this very, this notion that it's a very glamorous life, but it's actually a very tough life. And the other aspect, I think, is people don't realize that, 70% of what we do is actually spinal neurosurgery. So you have to consider all of those things. And I think the best way to go about that is to, do electives in it as early as possible to give yourself an idea of what you're letting yourself into.
I'll add on. I think one thing about doing electives and shadowing residents is that you do see how tough it can be, but also remembering that residency, is 6 or 10 years out of maybe a 40-year career. So it's also important to get perspective, to talk to, the attendings and staff who still work very hard, but at the same time, I think it's a more sustainable lifestyle.
Sorry, I was just muted. I was going to say, I certainly agree with that piece as well. I think a couple of things for me was also, it's definitely a difficult residency, and it's very demanding on your time and your energy. And, as PGY3, you're kind of really busy as a junior resident, so it kind of takes a toll at some point. But what I also noticed is that the idea of a work-life balance can be achieved. And I find that more surprising as the years go along, that maybe I'm just getting better at figuring out what works for me, but identifying, aspects of wellness that are, make me happy. And then this applies to everybody really, that that can be achieved. And you look at the stats, kind of like what Han said, that residency is a transient thing. And even in residency, there are multiple ways to kind of incorporate your hobbies and other interests in your life into neurosurgery. And so it's certainly not a, 2 circles, but some degree of a Venn diagram, maybe not as much as some people might like, but certainly enough that was happy for me.
Amazing. Thank you so much for sharing that. Appreciate it. So the next question we have is regarding tips for future applicants. So many of our members, including us, are worried about how COVID-19 may impact taking electives in neurosurgery as it did essentially the previous year. And so the question that we have is, what is your advice about Canadian medical students who are unable to do away electives during their fourth year?
So I might chip in on that. So as you know, match day was yesterday, I think. It was a rather successful year for neurosurgery in the sense that, a lot of people got their top choices. And so, it was a new year, not only for the, I guess, medical students who apply, but also for us on the other side of, not being able to see some of you guys in person. But I don't think it necessarily inhibited or impacted people in the sense that a lot of the new incoming residents, at least for UofT, a lot of them are not UofT graduates. So I think people are very open in terms of recognizing the limitations of the COVID pandemic, and so I wouldn't be scared that would necessarily negatively impact your ability to apply and reach broadly. If anything, I think that has opened doors for more people because we are more open to interviewing people, and we have to see what everyone has to offer. The second thing really is there are opportunities to gauge some degree of information about the nuances of the program by talking to the residents. So, you guys have a great opportunity tonight, but I think there are other opportunities that you can make for yourself in terms of reaching out to residents. And I'm sure a lot of us, while we're busy, are pretty happy to chat with you in the future if you had questions about the program itself. And so kind of going into decisions a bit more informed will help you guys make decisions and also get your name out there with the rest of the residents, so we know you're interested and kind of keep an eye out for you in the future.
Yeah, I think also just to add to that you are going to go through an interview process, and what I think people are generally looking for is these overarching themes of do you show a commitment to neurosurgery, like throughout your whatever prior things that you've done. Is it clear when we look at your CV and we hear you talk that you want to be a neurosurgeon and have done for some time, and you know what that involves? And I think that's the other thing about, can you have an intelligent discussion about why you want to do it? Are you realistic about it? And then, they're generally looking for kind of overarching, like, concepts. Are you bright? Are you academically bright? Are you doing well so far to date? Then they want to see that you're a decent human being. So do you have compassion? Do you talk? Are you eloquent with the way that you speak? And then it comes down to your neurosurgical knowledge, and really it's about being a good doctor. So in clinical scenarios, in interview, can you demonstrate that you're structured, that you communicate effectively, and that you actually have a bit of an idea about neurosurgery and neurosurgical pathologies and problems and how you manage them? So even if you don't get an elective in Toronto or in another part of the country, if you've done one locally and you've learned something, then I think, and you have all of those other characteristics, I think that does come across in an interview. And I think all of the interviews everywhere are pretty comprehensive in making that assessment of you.
I think they've covered most things. The only thing I'll add is I know the FMC doesn't allow everyone to do all your electives in one specialty anymore, but there's lots of opportunities. I did electives in neuroradiology. You can consider neurology, neuropathology, even like other surgical specialties that are close to neurosurgery, like vascular, ENT, plastics even. So I think having those experiences is really valuable. And I'll echo what Saira said, is, being a good team player, having that, those, that personality. You can always, teach people more things, but teaching them teamwork, teaching them a good work ethic is quite hard. So those are the things that you want to show off.
Yeah, thank you so much for great answers. So talking about the medical school, like a neurosurgery program interviews, so is there any specific experiences that you recommend medical students to have during their medical school in order to optimize the chance to getting invited for the interviews?
I think really it just boils down to have you, wherever possible, tried to have experiences that let you know and give you insight into what neurosurgery is about? So if you've done any elective anywhere, that's a good start, because, and what was that? Were you just standing in the corner and watching, or did you actually have a good exposure? And then I think, like Hans said, anything allied to neurosurgery, because, neurology is actually great because it will teaches you how to do a proper examination and to come to a differential diagnosis. And that's really relevant in neurosurgery as much as anything else. So I think, those kind of experiences that you're just demonstrating that you are interested in neurosurgery and you've gone about getting as much exposure and experience as you can, whether it be to neurosurgical skills that you think are relevant to that specialty. I think, that's the key thing, and everyone understands that we're limited by COVID, but hopefully this isn't something that will go on for years and years. So.
Yeah, I'll also add, oh, sorry, go ahead, Han.
I was just going to say, I think one thing that's important to think about in medical school is, being present. I think, sometimes people have the mindset, I want to do neurosurgery, and they completely ignore their OBGYN rotation. But I think at the end of the day, your goal at the end of medical school is to be a good overall doctor. And so even though you might have inclinations towards one specialty, always be present in everything you do. And it's the same during like residency. Some of us have more interest in vascular or something else, but when you're doing that spine surgery, which, 60% or 70% of the practice, you have to be present.
Yeah, and just a couple of things to add. So number one is this kind of worked for me is ruling out other things. And I know it sounds simple, but trying to do your best to explore all your options. Actually, medical school might be the only time really that you get to have the freedom to see other things, even if it's not in person anymore, but to try to capitalize on the opportunities that you do have to explore any and all specialties that you can, not only so that you become a better rounded doctor, but also that it kind of confirms things for you if this is the right specialty for you or not. And so when somebody asks you in a day-to-day question or in an interview why you want neurosurgery, it becomes a lot easier to answer that when you've seen other things. And then I think the second thing is, we're all adults, and so trying to make opportunities for yourself. And I know that's limited in COVID. And what I mean by that is not only learning about the clinical piece of things, but also exploring neurosurgery in multiple facets, whether it's, understanding what is the difference between community neurosurgery and academic neurosurgery. So getting a sense is research for you, and you don't have to necessarily do research, but, understanding what the types of research that's out there and what opportunities might look like to see if that fits with you. And that might also help you with program selection. And the same thing goes for looking at online resources and learning about leadership in neurosurgery, et cetera. So these are all the multiple facets in which neurosurgery is involved as an institution. And so the more you learn about it, the better it is for you kind of understanding the specialty and the programs as well.
Excellent. So on that theme, we're going to move on to mentorship. And because the theme here is about women in neurosurgery, one of the questions that is very often and frequently asked is, during your training, did you have a specific female mentor that encouraged you to pursue electives and eventually neurosurgery or other areas of interest, or people that you really look up to and were inspired by? If you could also comment on that, that'd be wonderful.
I would say my mentors back in medical school at Western were Dr. Bolton and Dr. Ng, both of them who actually, I think coincidentally trained in Toronto. But I think what really sparked my interest was, I knew I wanted to do surgery early on. And then, the fact that neurosurgery is a specialty where there's a lot of acuity, you're really dealing with things and running around and, solving problems. That's kind of what drew me to this type of practice, but also the pathologies we deal with are very, I think, very important for a lot of our patients. Talking about brain tumors or, end of life discussions when you are having bad traumas, all that actually was something that I found I could really make an impact in. And Dr. Bolton and Dr. Ng were two of the staff who really, were very, I think, well-rounded in their approach to patient care. And so that's kind of the people who really drew me in towards neurosurgery.
Yeah, I think, from my perspective, having a mentorship is quite a unique relationship. And I think it's difficult. Did I have female mentors? Probably not, no. Did I have many male neurosurgical advocates? Yes. And I think that, I started out in England, so I was an intern in Cambridge, and I would say that department supported me heavily and helped me get my residency in England. And then my bosses in Leeds were very supportive, very encouraging. And then, I found the same in Toronto. I'd say that, it's that we have 2 female faculty across 4 surgical and neurosurgical sites in Toronto. And although they are fantastic, we have like 35 plus residents, and it's difficult to get mentorship and to have that. But I think generally, having a mentor can be difficult to find, and I think that's something that we're looking at in Toronto, of how we can improve that. But definitely, I think if you go in with the mindset of working hard, doing your best, and really demonstrating a good skill set. So it's not just about being surgically great, but it's about being a good communicator, working well with other people, then I think generally you will find advocates. And I would definitely say that across the board, I have had many advocates that kind of propelled me along in my career, for sure.
Yeah, that's great. Thank you so much for sharing. Absolutely, I personally had my own advocates, and I can definitely agree with those comments that have helped me, come to medical school. Just before I ask the next question, I know there are some questions coming in, but just wanted to remind, everyone that you guys are definitely, to our audience, you guys are definitely more than welcome to ask any questions you have. We wanted to kind of engage in Zoom, so that's why we didn't make a Slido this time. But yeah, feel free to either type or add questions and we can read them, or feel free to open your mic and ask questions away. So maybe I'll just ask my question, because it's sort of related to the previous question, but on from an opposite perspective. But then we can give some chance to some of our audience to ask their questions too. I'm wondering if you maybe can share. Were there at any points any hesitations upon entering neurosurgery as female medical student, and if so, what hesitated you to or what brought on those thoughts?
I mean, I would say to that maybe I was naive, and I probably was, but when I first started on this whole neurosurgical journey, you're quite young, and we're quite naive and a little bit dumb too. So we don't really think about the lifestyle consequences, because when you're in your 20s or your early 20s, you think that you're going to be in your 20s forever. And you don't really think about the long-term impact of your life. Now, I've probably done a longer training program than everyone else here. And I can say that, your priorities and the way you think about things does change as time goes on. And I think the biggest thing that you have to think about is, residency is tough, but like the others have said, it's not forever. And what you have to consider is, at the end, is that lifestyle, the neurosurgical lifestyle, what you want? And will you enjoy doing that forever? And I think that was true for me, at the very beginning of my journey. And I would say that's still true for me now, that there's more and more that I learn that interests me, that drives me, the further I go through, the more I realize how much I don't know. And that kind of mental stimulation is going to be there, I think, for your lifetime. And I don't think many careers offer you that. And I think the other aspect is that the variety in neurosurgery is very, it's such a variety of things that you can do, from epilepsy surgery to vascular, to tumors, to, you know, pediatric neurosurgery. There's such a breadth that, you know, there's so much to explore that it will always, I think, remain interesting. So I think, although, you know, maybe I'm not answering that question very well, but I would say I didn't have reservations, but I was young and dumb. But I think the overarching theme is if you enjoy it and you love it from day one, you probably will do all the way through, because there's enough to keep you entertained and interested.
Yeah, I would echo that.
I guess I'll say.
Oh, sorry, go ahead, Han.
Go ahead, Anne. You went.
Sorry. I was going to say, I was echo that statement. I think for me, I did have, I'm not sure if I necessarily had reservations, but people around me had reservations. They tend to be a person that likes to do a lot of things outside of neurosurgery. And so family around me were like, you know, what are you doing? Like, why you want to do neurosurgery? When my mom wanted me to do dermatology so badly. She said, you know, you could work an 8-to-2 life and just have all these other things outside of work. And this is where that whole thing of trying everything but neurosurgery came into play for me, because I tried very hard to like something else. And personally, that helped because I realized that I'm really passionate about neurosurgery. And to me, it actually makes me happy being here, and doesn't interfere necessarily as much as I thought I would with other things. And so it's worth the sacrifice and the hours that are put in, because I felt that my day on another specialty, even if it was technically shorter, for me, it felt a lot longer and a lot harder when I was on other rotations. And so that kind of speaks to the fact that it's not so much the time, but also just kind of your level of interest in what makes you happy. And so doing something that's important for you, and not putting too much weight on what other people prioritize as important and what other people value as work-life balance. It may not be that for you. And so for me, that reservation first kicked in with other people's comments until I realized what actually made me happy. So.
Sure. I think, Anne, I have a very similar story, but I think it's true. Like, even when you're in medical school, you might have other, you know, people say to you, I think, you know, what ENT staff had said, why would you consider not a lifestyle surgery, like, you know, perhaps ENT, but I think it really, again, is where your interests lie, what you feel the most passionate about, trying different things during medical school. And I think at the end of the day, when they say whether or not you can have it all, you can remember that you kind of will determine what kind of practice you have in the future. I think neurosurgery is a little bit more difficult, since more often than not, you'll be at an academic center, but, you know, if you consider the US as an option, there's a lot of ways you can structure your own practice and determine how you really want to have that work-life balance.
Thank you so much. So changing the theme a little bit, I'm going to ask about the a work-life balance during residency. So do you think there's a work-life balance in neurosurgery, and or do you have maybe work and life as a continuum? And then what are your personal experiences regarding this a work-life experience?
I guess as the resident who's on call and on the clinical service. So, I mean, work-life balance is it's a broad term, right? That and it's something that evolves, and so there are, you know, certain services and rotations and days that are busier, and I'm currently on one, so I've gone through my share of lean cuisines and Michelinas for the past week. So there are times when you can't quite fit it all, and that's fine. But in terms of the call and whatnot, you know, the weekends where I'm not working, I certainly make a point of it of you know, doing meal prep for that 1 week. And I said, even if this is the 1 week I eat something homemade, it makes me happy doing that. Or you know, going running, right now it's more of an internal jog than going outside with the whole snow thing, but you know, fitting these things in on the weekends where you're not working. And there are rotations that are lighter. So when I was off service, office, I certainly made a great utility of that time off to do other stuff outside of neurosurgery. And when it wasn't COVID, hanging out with friends, going out for dinners and that kind of stuff. So that's all a possibility. And if that makes you happy, then sure that's is totally fittable. If you have a very involved hobby, like if you're pro hockey player and you need hours and hours to dedicate to that, then maybe that's not feasible. But if it's something more that you just need to incorporate certain hobbies in your life, there will be days when you can't do it, but certainly in the realm of a month, you will fit things in accordingly. So speaking from somebody who's on service, Han, you look a bit more relaxed.
Yeah, for sure. I think it's interesting. If you ever look this up, there's a JAMA surgery paper that's surveyed surgeons, retired surgeons, and their reflections on their career. And the number one thing I think everyone said was more time with family and friends. And I think that program director often says you should practice how you want to run your actual practice in residency. So if you want to be just a clinical surgeon, and some people are like that, more so in the States, I would say that's maybe something you would focus on, your clinical surgical skills. If you want to have an academic practice, you may sprinkle a little bit of research in your residency as well. But so I think it's important though, that whole time, to remember that when you're eventually in practice as an attending, there's probably going to be elements of clinical research and family time. So it's important that even during residency, when you are really busy, that you kind of learn the skills to make time for that, because it is a skill set in some sense of making time for friends and family. And I can definitely say, I think when I was a junior resident, it was a lot harder for me to connect with friends and actually do things. And now it's harder because of COVID, but I think that's something that I definitely missed during junior residency compared to now.
Okay, I have two questions. Is it okay if I ask them live?
Yeah, go ahead.
Hi, okay, all right. My name is Clementine Ofana and I am a postdoc IMG. So I have two questions. One is more on the personal side and then the other one is more on the research side. So personally speaking, I wanted to know, how do you manage to manage your career in neurosurgery with relationships and also family planning? During my other past sub-internships and rotations with programs in the US, I heard different female neurosurgeons saying that they actually had to plan, if you want to get married or if you want to have children, then you probably going to plan it on a year when you are less busy, like your research year and things like that. So I wanted to know, what is your perspective like on that from a female point of view? And then in terms of research, I wanted to know, given the current pandemic where we don't really have the opportunity to meet in person or doing surveys or observerships is super limited, how do you recommend that we connect with residents or programs with whom we want to be involved in research with? Thank you.
I'll take the first part of that because I'm the oldest one here. So family planning, very difficult. There is never really a right time, and residency is so all-encompassing that it can be very difficult to prioritize that. But I think what you have to, and what I've seen throughout all my years, is that people who do cultivate relationships and things are generally happier, and they have a greater longevity in their careers. Because learning to juggle those things of having a partner, children, and all of that will be what you will have to do when you finish. So I think that there's no ideal time, but you can plan it. So like doing it in your research year, for example, or if you did a PhD, would be a good time to do it. Speaking of which, that was family. But I was going to say, so I think you can plan it for research time and things like that. It is challenging, but it's not forever. So I think you need to remember that. And then I think the other element is from the other part of that question about research and contacting people. I think, if you approach people who are very academically active and productive, they will have, you can engage in an email conversation with them about, what you're interested in and what you'd like to do. And I think most people would be able to help facilitate, to be honest. I think it just depends on who you go to. And I think going to people who are very productive academically, or who have, quite a wide interest of things, you're more likely to have success there than going to people who maybe publish 1 or 2 papers a year. So, that's where I would go with that. I don't know about what the others have to say.
Yeah, and I think the other thing of seeking people out for research is finding maybe projects that you personally have interest in. Like, I think if you don't have interest in the project itself, sometimes it just feels like busy work. So I agree with finding productive PI, but also finding topics that align, the PI's topic research subject aligns with your own interests. But that being said, I think it's totally feasible to reach out to residents who may be in certain labs, or but reaching out to PIs may get you, more of your own project if that's the level you're at. So it also depends on your own research experience, right? If you think you need a lot more guidance versus you think you can be quite independent, may determine where and who you might want to email. On the family planning part, I think it's very difficult. I remember in medical school, I was part of an interest group about women in surgery, and I think it's different for a lot of different people. And I've heard everything from it's much better to do it when you're staff to makes more sense to do it during residency. And I think there's a lot of different factors for each person and each family. And I think also some of these things, it's impossible to really plan, and you kind of have to make do with what happens in some sense. But I think having the ability to plan, and if you have ideas about what you want, that's what's the most important. So figuring that out doesn't have to be right now at this stage, and I think it's something that's always an ongoing discussion as well.
Yeah, I totally agree with that. And I think also kind of seeing that, a lot of things are possible, and looking people around you is kind of reassuring. So, the program can be minimum 6 years, it can be maximum 12, depending on what you do. So certainly life doesn't wait for you. But looking at some of my female colleagues, there are those who have kids during junior residency. There are those who have it during research. There are others who have it during, senior life and fellowship, et cetera. So there are people who are kind of proceeding in that aspect of their life at various stages of their career, and it's difficult at every stage for various reasons. And so but they just do it. And so not only goes for the women, but also a lot of the men in our program kind of become partners or fathers at some point in time, and it's only natural if given how long the program is. And so everyone's understanding of that and making ways for family, whether it's supervising them, going to their games on the weekend whenever you can, et cetera, et cetera. But just seeing that other people can do it is kind of a little bit reassuring for me for the future.
Excellent. So we're going to now go on to some of the questions that are raised by the audience. I have received some private ones. If you could share them with the group, it'd be great. I'll go in the order and we'll read them. The first one that I see here is by Niku. The question is about patient interaction. How much one-on-one patient interaction outside or do you get in neurosurgery, and what is the continuity of care like? Was this a factor that crossed your mind when choosing the specialty?
Yeah, I would say that you do get a lot of patient and family interaction, and it's often very challenging because most of the time, you're giving very bad diagnoses, whether it be brain tumors, trauma, a vascular hemorrhage. So I think you will get a lot of patient interaction, probably more than you anticipate. A lot of it is breaking bad news and managing difficult consents about surgery. People want to know what to expect, and you often don't know. And then continuity of care, it's difficult if that's it's probably there more than you think, but obviously beyond the surgery and you know, a period of inpatient stay, it's not the long term that you're dealing with patients. But it can actually be quite nice because you probably see them at their worst, and then when you see them again in clinic, they've done remarkably well, and you feel way better about life. So yeah, you know, you will get a lot of patient interaction for sure. And I think actually you're probably going to have more meaningful and serious discussions than you would in most other specialties, if I'm honest.
I think I said one of the things that drew me to neurosurgery is really how you may connect with families. During electives, I've seen, you know, conversations about surgical decision making done well, and I've seen it done poorly. And I think that's actually a skill that isn't, you know, taught inherently. It's a skill that really does take time to develop. And so that interaction is very important. And I think it's actually crucial to a lot of decisions you will make in the clinic and in the emergency room. And I think that, you know, as residents, we may not have the same continuity of care, but a lot of people who do, you know, oncology work, who do even vascular, they have to follow their patients up after treatment. As an actual attending and staff, I think there is really good continuity often with your patients, and a lot of important relationships I think do develop as a neurosurgeon, just because of the fact that people think you're doing brain surgery on them. So that's something I'm looking forward to in the future.
Yeah, I actually, one of the things I really liked about neurosurgery was the communication piece with the patients, not only in terms of, you know, day-to-day discussions. Everyone's, you know, very different. And so you have the opportunity to kind of meet a myriad of people throughout your training. But I think we kind of encounter people in the most critical times in their lives. And sometimes it's a time of great vulnerability. And other times it could be, you know, in cases of palliation. And so you learn quickly to be human and humble, and how to communicate effectively with patients on not only what your interests are as a surgeon, but more importantly what their interests are as a patient and as a family. And there are a lot of social dynamics that come with this. And so as kind of Han said, it's a little bit more of an art than a science, but I think that the opportunities we have for patient interaction in that regard is quite immense. And we cover things not only from ethical surgical decision making, but also palliative care. And so and that's an ongoing thing. And patients come, even if they're, you know, have terminal brain cancer, for example, that you may not be able to operate on, but we certainly see them in clinic and we follow them up over time. So that opportunity to be an important part of somebody's life at various stages, whether it's a positive outcome or even, you know, a more palliative, you can make a huge difference in someone's life. So I think that's a great honor, to be honest.
Okay, excellent. So before we proceed forward, one of our future event speakers is actually here as an audience member, Dr. Jenna Smith-Forrester, who's a PGY3 at Dalhousie. And I just wanted to also introduce her as well, that if she also likes to contribute to the panel, she's more than welcome to. And with that, I'm going to go to the next question because I've been getting a lot of private questions. I'll try to go in the order of the private messages. So the first private message question that I do see here is pertaining to IMG, specifically about research and maximizing their chances. There are also some variations of this about obtaining letters for the residency match. So if you could kindly comment on that, that would be wonderful.
Yeah, sure. So, you know, as an IMG, so first of all, I always say whenever I give talks to the IMGs that you need to be realistic. You know, look at the number of IMG positions in neurosurgery Canada-wide, and every year there's one or there's two, and that's it. So that's what you're going for. And it's not easy because, you know, frankly, most of the time they would rather not take anyone than take someone that they think is a risk of being not up to standard or problematic. And quite frankly, the Canadian candidates are outstanding, so you have to compete against them. You know, so that's your starting point. Then you have to meet all of the criteria. that goes along with that, which means doing all of the relevant exams, scoring very highly, you know, having your Canadian permanent residency, because that's a limitation to applying through CaRMS. And then once you've done all of those exams and all of those mandatory criteria, then it comes to the other things. So how are you as a doctor? How are you as a communicator? How are you, you know, in all of those realms? So you do need to have North American experience in clinical practice, and ideally in neurosurgery, because that is often an unwritten requirement. So if you've done, you know, you can have done, I had done 4 years of neurosurgery in England, and it counted for nothing when I applied as an IMG. And it was actually having done 6 weeks at one of the UofT hospitals that was what counted. So you need to be prepared for that. And I think, you know, find ways to get that North American neurosurgery experience. And then be realistic, right? Because you're going for 1 or 2 positions. And remember that Canadian graduates who go abroad to do their medical school and come back are also IMGs. So it's difficult. And really, you know, I would describe it as akin to a miracle in many ways, is to get in. And then to get into a good program like UofT, it's very difficult. And, you know, I think it takes a lot of luck as well, and a lot of stars aligning, I would say, for that to work out. So as long as you're realistic about it and you have plan A, B, C, D, E, then fine, go for it. But, you know, I just, that's my warning to people, that it's not easy. And, you know, it's not impossible, because, hey, I'm here. But it does take a lot.
If I may just ask a question. Thanks for your many insights so far. My name is Irene, and I'm a MD PhD student at Toronto. I'm just wondering, looking back, is there anything that you would have done differently in preparing for and applying to neurosurgery residency? Or perhaps something that you didn't know about neurosurgery that surprised you upon entering?
Looking back, I think, I mean, it's hard. I think with electives, it's really, if you are able to travel around, it's really, I think it's nice to develop more relationships with the different people. I think that's something I would have liked to do more. I think we were very lucky to be able to have a CaRMS tour, even within my own cohort, like Matt Eagles, who is speaking at another event, like we still communicate with him. Like I know that, you know, he recently had a kid and all that. So the Canadian neurosurgery is not a huge group. And I think that the relationships you build even at a young state, you know, this group is actually great because you're even bringing everyone together at an even earlier stage. But when you're going around electives, I would have loved to build even more relationships that could have, you know, lasted over time. Yeah.
Okay, thank you so much. So I'm going to actually ask another question. So do you think that with the patient encounters, when they think about the neurosurgeons, that would maybe affected by the gender of the healthcare practitioner? What's your experience on that?
Yeah, you know, I don't think that patients have a negative perception of neurosurgeons. I think most other specialties don't like us. And I think the reason behind that is because we are often very busy and very stressed, and therefore we don't really show our best selves when we are in those states, and we communicate, we can be abrupt, and I think another key element of that is that a lot of people don't know that much about neurosurgery because you minimally cover it in medical school, and that's the only exposure they ever get. So they don't have a good baseline knowledge and then they're communicating with us, and we're frustrated and busy and tired. So it doesn't lead to a great interaction. But I think patients generally, have that TV perception of you're going to be a brain surgeon, you're super smart, and we should listen to you on the whole. But I think that things can be challenging with other specialties because of the dynamics of things. And the other thing I think is that we really often manage people who are really, really sick and are, who are about to die sometimes when you're in the emergency department. And we become very comfortable with that. But no, not everyone is comfortable with that. And so, it sets up strange dynamics because we're often the very calm person in the room, and everyone else is like, but why aren't you doing this now, like 10 minutes ago? And you know what I mean? It's interesting dynamics that can develop, but I would say on the whole, patients are generally like us, I think. I don't know what other experiences are. I haven't had any issues.
Yeah, I guess I will comment to that as well. So, I mean, neurosurgeons and neurosurgery residents are kind of like Smarties. I mean, they come in many different colors and whatnot. So, I mean, we're all different. So, there are three of us on this call in terms of resident wise, and we do not represent necessarily the whole population. And I think that's great. And so what that means to me is that interactions with patients and with other residents doesn't have to be a stereotype. So there are a lot of, people, even when we're tired and whatnot, that are extremely pleasant, and you get to realize that when you do principle of surgeries and whatnot, because you start meeting other surgical residents from other specialties, and you make friends across other specialties, and the interactions you make with these people oftentimes can be very, very pleasant. And so it's nice when you get a consult or you get a text from somebody that and there are some residents in my program that literally are always smiling, and sometimes I want to shake them and say, how are you so happy? Like, how are you not more tired? But I guess my point is that the interaction, I know like Saira brought up a point, and there are some stereotypes even about, neurosurgeons and them being difficult to be with or difficult to interact with. And I don't want that to be necessarily the case, because there are a lot of people who are even a lot better than I am in communicating, a lot happier and more pleasant at times. And so it all comes down to personality, and that applies to be honest, to any specialty. In terms of the female part with patients, the only thing I noticed, and to be honest does not bother me, is that whenever, even if I introduce myself as a neurosurgical resident or as a doctor, more often than not they think I'm the nurse. And at the end, when I present a case to a staff, they'll say, oh, this lovely nurse has already assessed me and whatnot. And so I don't, that's never comes from a negative place. It's just a naivety of the patient, and so I never take offense to that. But I always just try to do a good job at introducing myself, because it does become important and you do consent and whatnot, so they understand your role in their care. So that was the only thing that I kind of noticed amongst the patients. I think if you're open-minded and you recognize that people come from different cultural and religious backgrounds, and that part's important to them in some aspects of decision making, they'll respect you, and that respect can be mutual. I think the only time I've ever been, I think, not discriminated, but sex became an important thing, was sometimes in certain cultures, examination by a female of a female patient was preferred over a male. So that was the only thing that I noticed.
All right, so thank you so much for that excellent discussion. And I guess the next question I have in mind, sort of along the same lines, is, as part of this series, our whole goal is to, advocate for diversity, for equity, and for an increased ratio of females to males in neurosurgery, but just not just in neurosurgery, just in surgery as a whole. The question we have in mind is, how would you advise us to, make that advocacy better, so that, down the road we'd see better representation of female residents and specialists in the surgical fields?
I think it's a really hard question overall, and I think something that a lot of different faculties across, Canada, United States, everywhere is looking and thinking at. I think, the minimal steps are things like this, where you're just having people talk to each other. And I think that even with our own residency program, we've had residents who were here like 10 years ago, went away for research, but when they started, they were one of two, maybe female residents. But now that number has definitely grown. And I think the fact that we're able to talk to each other, support each other, support people who may consider joining, female neurosurgeons or female surgeons in general, is important. So having those conversations, and I think there's a lot of different forums, with the WNS, there's the Women Neurosurgery group. And I think that brings a lot of connotations. Some people think that they, get together and sip tea or something like that. But not every female or woman neurosurgeon want to join that group, but that's totally okay. So I think that the fact that there are just more people around, more people willing to have conversations, means that there's different opportunities and avenues that anyone can come to talk to people about the specialty. That being said, I think the issue is much more than just sex. There's a lot of different aspects of a person's identity that overall the surgical specialties can expand upon. And the benefit of diversity, obviously, is that we are here to serve a patient population that is diverse. So having experiences of different socioeconomic status, a lot of different aspects of identity is important for every specialty, I would say.
Yeah, I think we're getting there. It's one, the passage of time, I think, setting a precedent. I mean, we have, the four of us on here and three of us are from Toronto. And I think we have about 7 girls actively in the program, 3 who have just finished. So, we are getting there. It takes change on multiple levels, right? Having more faculty female representation, recruiting and attracting diversity. But, I think ultimately it's not attracting diversity as such, but it's attracting the best candidates. And I think that you will find, if you do that you get diversity by default. And, you can see that Anne, Han, and myself were very different in terms of personality, ethnicity, and in even the way that we work, we're all so different, and we each bring our respective skills to the program. But I think there's it's a good time if you are interested, because there is a real drive at every level, university level, hospital level, medical school level, to really enhance diversity and improve inclusion into surgical specialties and even neurosurgery right now. There are so many. In the last year, I've been quite shocked at just how many different organizations have held events related to EDI in neurosurgery. So if you're interested, it's a good time. But I always say, and I've said it, for as many years as I've started, is that don't focus on your gender, focus on being the best that you can be. And if you focus on that, then I think that you don't need to worry about what your ethnicity or your gender is. I think someone at my medical school said, cream always rises to the top.
If I may, Saman had introduced me earlier. My name's Jenna. I'm finishing my 2nd year of neurosurgery at Dalhousie. And just to add on to what Saira was saying, the movement to be more inclusive and everything is working. Dalhousie's program, we just, with our CaRMS match yesterday, matched our 4th female resident. So we'll be 4 of 10. And have 2 female staff in our program as well. So 6 of 20 is starting to definitely shift that balance in a positive direction. But the comment that Saira made that I like the most is it's not really about gender at the end of the day. I'd say with Dalhousie's program, one of the things that I love is I go to work and I don't think that I'm a woman in neurosurgery. I'm just going to work in neurosurgery and have that great privilege and get to live out that dream every day. So when people mention like, oh, what's it like to be a woman in neurosurgery? It always kind of feels like you're taking half a step back, because you're like, I don't think about that. I don't go to work thinking about, oh, I have ovaries. I'm like, I get to go to work to do something I love and work with other people who are doing exactly what they love. And I think it creates a really like beautiful team dynamic in our space here at Dal. And I will just quickly touch on Clementine's question from earlier. There is another session that's coming up next month that will focus on pregnancy, motherhood, family planning, and I'll be speaking at that with another staff member and possibly another colleague as well, so we can go into more detail around that. But I actually just had my son, he turns 1 month old tomorrow, so I've just started my maternity leave, and we'll go into more detail on what my experience was there. So anyways, great conversation, ladies. Thank you so much.
I had a question similar to kind of shifting landscapes, thinking about culture. So I think surgery in general and neurosurgery kind of sometimes gets a bad rep for not having a great culture. And I think in general, things have been shifting a lot. There's so much more talk about wellness and so many initiatives. So I was just interested in your insights about how you've kind of seen things shifting.
Yeah, I mean, I think there's been a big shift, and I see it in Toronto in particular. And I will share this anecdote. When I started out in England as the PGY1 equivalent, I was standing in the OR, and my head of division there said to the other guy, "She looks all right, but give it time, she'll be a bitch before you know it." And I think, that's about a decade ago now. And I think that you would never hear that said today. So we are making, we're moving leaps and bounds. Now we're talking about EDI, we're talking about wellness. We have at the UofT this, a once a month event where we all get together online via Zoom because of COVID and talk about stuff to do with wellness and stressful events and everything from like how we can recruit good candidates and what makes a good candidate. And it's not just about people who are academically brilliant, but there's a recognition now that to have these softer skills, to be able to be a good communicator and things like that matter. And actually, if you get someone who has the right personality, you can make them into a great surgeon and you can make them into a great academic if you want. So we've come a long way. There is a long way to go. But, I would say to you that if you're passionate about it, and, there should be no reason for you not to pursue it. And, you're in a very exciting time, I think, not just in a neurosurgery or surgical level, but in a global level. Things are shifting and changing. And so make the most of it.
And I think you make the culture. Like the thing is really how every cohort, even every year, is very different. And I think it's about how they themselves discuss how they want to deal with the stresses of residency, right? I think within each group you can decide, hey, this is how we like our post-call days, and within reason, if you are set up a strategy amongst your group and your team, I think those are the important things, and people recognize when people have other commitments such as family or new stressors and things like that. So having the ability to talk to each other is important, and I think that's why when we look at applications and teamwork, that's actually so critical.
I have a question, and it's, I think, a bit difficult to answer, so I'm not sure there's a perfect answer to it, but it's more surrounding this, I really don't know how to phrase it, like in terms of knowing what you're getting into, so to speak, because I feel like as a medical student, especially with the sort of electives cap and with COVID and everything, I'm finding it challenging to know, just because this is something I'm passionate about, and I think probably everybody on this call is passionate about it, like how do we get a sense of really this long-term idea of how it feels? If you could comment on that, it would be much appreciated.
Yeah, I think, it's hard. So, start with an elective, and I think look at other specialties too. Like, do they generally interest you? And I would say that, way back when, I was interested in neurosciences and actually neurology. And then I kind of saw that mainly what neurologists did would spend a lot of time diagnosing people and then giving them steroids. And I thought, okay, that doesn't really do it for me. So I think, take a structured approach. Do you generally enjoy neurosciences at medical school compared to everything else? Like, does that stimulate you? Then say, okay, well, do you actually like surgery? So go to an OR and see, do you like that? And then go to a few different ORs, and see what general surgeons do. And I think you will find that something triggers in you that is more exciting for you than everything else. And then, speak to people who are at different stages of their career. So if you wanted to, we could tell you people who would be very receptive to hearing from you in Toronto, who are like early career, like George Ibrahim, lovely guy, and can talk to you about what drove him into it and how he feels. And then speak to people who are like mid-career and end career, and engage it that way. I mean, I think you have to be innovative in these times, and that's probably the approach I would take. But you'll know if you're in an OR and you hate it. And you'll know very much if you're in a clinic and you hate it. And just spend one day with a family doctor and you'll know whether you like that or hate that. Because I spent half a day and I was like, I'm done. So, go with your gut. Your gut instinct is usually right, I think, with these things.
I'll offer a counter. I agree with everything Saira said, but the truth is there are people who enter neurosurgery residency and change their mind. And I think some people will think of themselves like, oh, I'm a failure or whatever. But I think at the end of the day, you just have to be real with what you want out of your career. And it's okay to even change during residencies. And people have, I know of even people who, came into neurosurgery mid-residency from general surgery and other things. So it's important. I think, it's probably more streamlined if you do have a good idea in medical school and then pursue the ones in residency throughout. But I know of people who've done a full residency and then done a second one. So don't ever think that you're inadequate for trying to think about what you want for yourself, and things change over time. So it's obviously nice to get the best sense that you can with all the information that you have, and obviously COVID makes it more difficult to figure out this question of specialty, but at the same time realizing it's never the end of the line. You're always in charge of your own life to some regard, and it's this process of exploration can be ongoing.
Yeah, I completely agree with Han on that one, and Saira as well. And make utility as much as you can during your elective time, and also your core rotations for those of you who are CC3s, to kind of, or even earlier than that, to kind of shadow and then take the opportunity to see all the rotations. Cannot stress enough the importance of just also enjoying that opportunity to kind of explore everything. And I think part of that is, somebody actually was one of the vascular surgeons at Toronto General once told me, it's important to appreciate and enjoy the patient population and the diseases more than the procedures that you're doing. So sometimes you go into an OR and let's just say you're really happy there and you've checked off the box that you like surgery, and that's great. But then you kind of say, oh, I really like this procedure. It's so cool. I can imagine myself doing it. And you kind of get ingrained in that. And then the reality, particularly of neurosurgery, is that it's an extremely evolving specialty. So that particular surgery can change and what and how you do it, and even if you're doing it, by the time we even graduate our residencies, you know, certain things are being taken over by more minimally invasive approaches and whatnot. And so the reality is that, you know, the OR is great, but you really need to be passionate about the patients and the diseases and the opportunities to make change in that way, whether it's even kind of contributing to new and inventive techniques to deal with that problem. So don't get caught up on the particular, you know, nuances of a procedure or whatnot that you might find interesting. It's great that if you do find it interesting, that kind of probably makes you a little bit more comfortable in recognizing that surgery is for you. But take a look at the patients and the diseases and see if that kind of speaks to you at all.
Thank you, everybody.
Yeah, great. Thank you so much for those answers. And Britta, thank you for asking that question. In fact, I think we have just under 10 minutes left, but at this time we actually want to open it up. So please feel free, and if anyone has any questions, please feel free to jump in, turn on your mic and ask your question away. Otherwise, we also have some questions in our reservoir. So, but at this time, we just want to give the opportunity for our audience to ask any questions you have. So please.
This one is again like non-neurosurgery related, but I'm just curious to know, what do you doctors do outside of neurosurgery, like when you're not on call? What extracurricular activities do you do? What do you enjoy doing?
Okay, well, before the pandemic, my husband and I used to do a lot of escape rooms. So we're both on research now, and during his first year of research, he actually worked part-time for an escape room designing them. So our wedding was actually full of puzzles and things like that. I used to paint a lot more. I don't do that as much, and I kind of miss it. And running, I guess that's something I should do more of also, especially on research.
Yeah, I guess similar to Han, I used to be part of a more formal run club. Now I just do more solo jogs in a socially distanced fashion. I used to try to do a little bit more in cooking. I actually really suck at cooking, but I want to get better at it. So I've been taking these online classes and whatnot. And I think during research, I'll try to join a like George Brown, more formal type thing, and wine tasting. Avid want to become a wine connoisseur one day if my budget can afford it. I think just even simpler things as to me, what makes me happy is just spending time with friends. So a bit of a foodie, trying to find the newest spot downtown to get a bite to eat. Now with COVID, we just do take-ins and Zoom cooking classes or Zoom tasting menus on online fashion. So that kind of stuff I think is easy to do, and certainly you need to eat. So and that kind of lends itself well for a neurosurgery lifestyle. And I think the final thing a lot of us kind of do is traveling, whether it's in the fashion of research or just for pleasure. So hopefully the borders open sometime soon to get that back on track.
Any questions from our audience? More questions? You can also type it in the chat too. Actually, speaking of that, I'll go to some of the private questions that we've received. These are more logistically based. One of the questions that I don't think we had a chance to talk about was received almost an hour ago. I'll read it verbatim. It says, given the lack of clinical electives and the difficulty with getting FaceTime, do you still need 3 letters of reference from neurosurgery staff? It's a more logistical question. If any of you have any comments on that.
I don't know that any of us know exactly. I think the more that you can get from a neurosurgery staff is good, but at the same time, I think the most important thing is a strong letter. You don't want one from a neurosurgeon who doesn't know you well. You like if you work really well on a research project with a neurologist or someone, a lot of leadership with someone. I think the strong letter should, I think, trump the neurosurgery letter. That being said, I think it's important that somehow in your application you've demonstrated you have a commitment to neurosurgery.
Yeah, I agree with that. I think, you know, you need letters of reference, but you just want people to say that you're great. And it's not, if only one of those is neurosurgery, that's fine. I don't think I think people understand the issues at the moment with the climate of COVID and all of that. So yeah, I mean, and ultimately, if you are a truly excellent doctor and clinician, you will have no problem getting letters of reference from anyone, basically. So I don't foresee that to be a problem.
Okay, if no other comments, I'll read this next question. This is more about the USMLE. Some people are wondering if it's better to write the steps in during medical school or doing it in residency. I know this is not quite Canadian focused, but I know we have some people coming from abroad too. So if you have any comments on that as well.
So I think the thing I would say about USMLE is that you don't need them to apply to CaRMS. That's the first thing. However, what you do need them for more often than not is fellowships. So I probably not every, you know, I'm at a stage where I've secured my fellowship, and you know, you do need to have your USMLEs before you start your fellowship position. And I think generally it's a lot easier if you do it near med school, because actually that's probably where you have the most time. Doing in residency is really difficult, and you're also very far out of what you know, the step one kind of knowledge. So I would say to you that the earlier you do it, the better. Know that you're doing it for fellowship purposes, but obviously if you're going to apply to the US, and it's particularly if you're an IMG, with so few positions in Canada, you know, it's probably worthwhile for you to do them. But, you know, be realistic the whole way. It's a lot of money to spend. And, you know, look at what your chances are of getting that position in neurosurgery, wherever you want to be. But, you know, it is a requirement for the US, obviously.
Yeah, thank you. So we have also another question from one of our audience in the chat box that says that, so whether there are opportunities in global health and health equity within neurosurgery. As I've heard, this is a fairly new field.
So maybe I'll jump in on that. So certainly there's plenty of opportunity for global outreach in neurosurgery. It's a evolving subspecialty, and actually they're now for hiring, it's a platform and a pillar of one of the facets that they hire staff in is, you know, whether or not that's something that you want to take on or lead in your practice. So I went to Indonesia as a fourth-year medical student as part of one of the global health scholarships, and did a research project there. And I thought it was very, very interesting to be able to understand not only what surgery looks like in low to middle income countries, but also understanding how research is done and the opportunities for partnership and education as well as research moving forward. So there are formal ways of getting involved. So there's a global health education program. This is, I'll speak more about UofT, but I'm sure there are opportunities across Canada for this. And I asked this during my interviews, I remember. So UofT does have a particular program that helps surgical residents facilitate, whether it's an educational thing or a research thing, for a couple, I think it's a couple of years. And there are kind of more assignments and stuff like that you have to do, but you get a certificate at the end of that to help develop that part of your career if that's something you're interested. And then there's more of an informal aspect where there are several staff of various universities that this is a part of their interest, and so they are more than happy in taking a resident on, whether it's a week or couple weeks trip, or if it's an e-learning module type thing where you can create electronic information in collaboration with residents or learners abroad. So extremely, you know, varied practice, but certainly something that's at the forefront of neurosurgery at the moment.
Excellent. Seeing that we are getting close to the end of the meeting, first of all, before you leave, we want to thank the panelists for their insights. We know how busy you are. Scheduling this is not easy, and we're very grateful that you could join us. Again, if there's any more questions, you could let us know. We could use in future events, and this session, of course, is recorded. Before we end, I think Jenna also wanted to share some words again about the events that is upcoming about maternity leave. If there's any other comments you'd like to include, perhaps, or not sure. You're on mute.
Yes, I'm not sure that there's any additional comments, just the reminder that on May 21st, there will be another session. It'll be with myself. There'll be a staff member to provide their perspective on having a family, whether they had a family in their residency, in fellowship, or what it was like as a junior staff to have a maternity leave and what that looks like. I'll share my experience, obviously, as a new mom. It's more from the perspective of what it was like being pregnant and being on a neurosurgical service, and what programs were in place that I was able to utilize to make that manageable, and what it's going to look like for me moving forward. And then there's possibly a colleague joining that started residency with children. So she can provide another perspective. So you'll get a well-rounded exposure at that point. If there's any questions, I'm happy to answer it, but I think the next session will be, a great opportunity to look at how you can balance having a family and a surgical career.
Thank you so much again. And to our panelists, Saira, Anne, and Han, thank you again for your time. And thanks to everyone. Hope that you could make it to our future events. We have, I think the next one is Dr. Matt Eagles is giving a talk on neurovascular surgery. And we have the women series coming up in May as well. Thanks again. And we hope to see you soon. Have a wonderful day.